Thank you, everybody, for attending and asking so many questions. I think we answered at least 16 questions from you guys. So keep that up. We have Dr. Tran and Jennifer Bassett joining us soon for side of joining a school about what that process is like. So also, if you have any questions, keep asking them in the chat. And then later on, we'll have a panel with some podiatrists, so you can ask any more questions about that. And then a panel with students as well, so a little bit more about student life at this current time. So yeah, keep asking your great questions. I really, really appreciate it. Yeah, so let's see. Dr. Tran and Jennifer, are you guys ready or should we take a little break first? Hi, Dr. Tran.
Good morning, Miko. Good morning, everybody. So I caught a little bit towards the end of Dr. Vincent's presentation and chat there. So I don't know how long you have already been here. If you want to do a 5-minute bio break for your guests, we can certainly do that before Ms. Bassett and I launch into our segment of your symposium for the day. It's going to be riveting, for all of you guys to learn about the application process for podiatric medicine and surgery. So, I don't want people to be kind of antsy about hitting that restroom. So a 5-minute bio break, I think it would be nice for your guests.
Okay, perfect. I have a little screen ready to go. But yeah, let's take a 5-minute break. That sounds good. All right. Should we give it a couple more minutes, or do you think?
It's entirely up to you, Miko. I am ready to go, and I'm sure that Ms. Bassett is ready. She has at least another half an hour, right, before it launches into her segment of the presentation. But the dynamic duo of Tran and Bassett are ready whenever you're ready.
Okay. That's right. We are quite a dynamic duo, actually.
I think we're good to go then. Yeah, thank you.
Okay. So I don't know if you've given me the ability to share my screen, but
yes, you have that.
Oh, wonderful. Okay. So let me see here. Let me bring this up. So can you see my screen there? And hopefully it is a single slide screen. Yes, or multiple slides?
Got it. Single slide.
Great. Thank you. So first of all, welcome everybody. For those of you who I've had the pleasure of previously have met either during one of my webinars or during one of the counseling sessions that you've attended in attempting to learn more about podiatric medicine and surgery. Hopefully some of this information will be quite familiar. For those who are attending this symposium and this is your first step into the exploration of what podiatric medicine and surgery can offer you as not only a viable but a happy and fulfilling profession, then hopefully my presentation can give you more food for thought as well as an impetus to actually pursue this pathway. Towards the end of Dr. Vincent's session, as I was listening, I heard the question that was posed to her whether she knows of any poor or unsuccessful or homeless podiatric physicians. And I had to smile at that because the reality is in any profession, whether it is medical or otherwise, you are going to have unsuccessful people. But I think that if you were to talk to 10 podiatric physicians out there, probably 8, if not 9, are going to be very, very happy with their choice of choosing this medical discipline as their professional life. The other 1 person or 2 people that are unhappy, I think that there are other reasons for their unhappiness, and it's got nothing to do with the profession as a whole. So I want to echo what Dr. Vincent said in that this is an amazing profession. It offers you so much variety in terms of your medical practice. It is extremely fulfilling, not only for you as a professional, but also for your patients, because they come into you with ailments that you can actually rectify and fix for them. And you make a very, very comfortable living. You don't have to end up eating cup of noodles every single day, right? And Dr. Vincent mentioned about the concept of debt, good debt, sensible debt versus inappropriate debt. So this is, and I think that Jubin mentioned a little bit about this, this is an investment in your future. And I think that it is a great investment. So without further ado, let me go ahead and launch into my sharing with you what podiatric medicine and surgery is all about. Before I go ahead and do that, I just want to let you know who I am. My name is David Tran. I'm the Associate Dean for Admission at Samuel Merritt University College of Podiatric Medicine. In addition to being the Associate Dean, I'm also an Assistant Professor. So our students at the College of Podiatric Medicine have an opportunity to rotate through their clinical rotations with me during their second year homeless clinic, as well as their third year when they're rotating through the various clinical rotations within the San Francisco, Oakland Bay area. In addition to being a part of the faculty at the College of Podiatric Medicine, I also do practice as well within San Francisco, not only with the Bay Area Foot Care Group, but also at the local community health center in the Mission neighborhood area. So here are excuse me, a couple of links that I think that you will find very helpful and useful when you have an opportunity and plenty of time on your hand to take a look at what makes the College of Podiatric Medicine different than the other colleges of podiatric medicine that is available to you across the United States. There is a message, if you will, from one of our second year students about her life experiences at Podiatric Medical School, and then a couple of other YouTube videos that speaks to some of our commitment to service to community and so forth. So why should you consider pursuing podiatric medicine and surgery? Well, the first thing is that as a podiatric physician, you have a highly unique and a highly holistic relationship with your patient as compared to your MD/ODO counterpart. And the reason for that is that you are a healthcare professional that is caring for and ensuring the mobility of your patients. You are not just simply treating a pathology. You have to get to know your patients in terms of their living situation. Do they live in an apartment building? Do they live in a high-rise flat? How many stairs do they have to navigate? What kind of lifestyle do they lead? Are they more sedentary? Are they more active? And what other interests do they have that you can help so that they can maintain those interests and so that they can maintain their active lifestyle? Because once the patient's feet begin to bother them and they have discomfort and pain, it changes their entire quality of life, right? So as a result of that, and because you are who you are and the specialization that you have chosen to pursue, you have to develop this much greater in-depth relationship with your patient. You are not just simply treating a diabetic condition. You're not treating a hypertensive condition. You're not treating a congestive heart failure condition. You're treating a patient with a lower extremity foot and ankle problem that you can solve for them. And what is also unique about podiatric medicine and surgery is that you are both a physician and surgeon by the time that you have completed your residency training. And that aspect of your medical career is not guaranteed if you were to pursue, let's say, the MD or the DO route. So let's talk a little bit more about podiatric medicine, and in particular, Samuel Merritt University College of Podiatric Medicine, what the profession can offer you. Clearly, I can talk a little bit more in detail about SMU because I'm intricately involved with this program. I do encourage you to look at the other 10 colleges of podiatric medicine so that you can learn a little bit about their uniqueness as well. I will be focusing more onto the clinical aspect of things, and then Ms. Bessette will concentrate her part of the presentation on the nuts and bolts of how to be a competitive and successful applicant for podiatric medicine and surgery. So how do you actually become a doctor of podiatric medicine? So currently there are 11 schools that offer this program across the entire United States. You cannot become a DPM or a doctor of podiatric medicine by going through allopathic or osteopathic medicine. For Samuel Merritt University College of Podiatric Medicine, we've been around for over a century plus number of years. We were founded in 1914. So we've been educating and graduating amazing podiatric physicians since that time. As part of your education, you are required to complete your boards part 1 and boards part 2, which will then make you eligible for your residency training, which is usually 3 years of duration. By the time that you are successfully having completed that residency training, then you can go ahead and sit for your license to practice, and then you are out and you are practicing podiatric medicine and surgery. So in terms of Samuel Merritt University College of Podiatric Medicine, here is just a couple of slides showing the immediate vicinity around our campus. This showcases Lake Merritt and Old Downtown Oakland. This is really more for the benefit of those attendees who are significantly further away from us geographically, just so that you can see what and how wonderful the Bay Area is. And in terms of our immediate campus, here are a couple of slides showing you the physicality of our Oakland campus. I would be remiss by not sharing with you that we're actually in the process of building a brand new campus. Groundbreaking for our brand new campus actually happened earlier this April. Groundbreaking happened in early April, and we are hoping that the new sparkling, brand new, amazingly filled with technology campus will be completed by late 2025, early 2026, so that our students and faculty can get the benefit of this amazing new facility. So here are a couple of pictures that shows you our new beautiful campus. And then what else does Samuel Merritt University College of Podiatric Medicine offer? You know, there was that question about costs of medical education. Undoubtedly, it is expensive, but it is a huge positive investment to your future, not only in terms of your career, but your personal life as well. Samuel Merritt University is very, very aware of the financial burden that medical education can place on our students. So we go to extraordinary lengths in trying to minimize that financial hardship. So we offer a multitude of scholarships throughout the entire podiatric medical education experience. At the very first year, when students enter into our program, we offer an entrance scholarships. These are generously made available to us by the associations of our alumni. And those entrance scholarships usually include the regents, the presidents, and the deans as well. These can range anywhere from $5,000 all the way up to $20,000 of scholarship that is renewable per year. Just this year alone, we actually had a new scholarship that was birthed as a result of the generous donation from the Dr. Russell Lewis estate, who is an alumnus from the College of Podiatric Medicine, and he gifted Samuel Merritt University $10 million. And so I think that clearly answers the question that can you be successful in podiatric medicine? And the answer is a resounding yes. So that $10 million donation was gifted to both podiatric medicine and nursing because Dr. Lewis's spouse was a nurse. And so that funding was split between those two programs to generate scholarships exclusively for students entering into those pathways. And in addition to those two scholarships for this cycle, we are also offering an early decision grant in the amount of $5,000 for those students who commit to Samuel Merritt University College of Podiatric Medicine. And so you can see this is the kind of energy, this is the kind of support that the university offers our students, and they are constantly looking for ways and avenues to try to offset and reduce that financial burden for our students. So cumulatively over a 4-year period, if the student is able to access all of these scholarships as well as scholarships available to them through years 2 and 4, potentially you're looking at a minimum of a 50% offset of your cost of tuition over 4 years. In terms of what the university and the College of Podiatric Medicine at SMU offers, we do target a very, very small class size per cycle. We attempt to not to exceed 48 students per cycle. And there are various benefits to this effort by the university. One is that you get a much more smaller, cohesive student body where every single student knows each other, and so therefore they collaborate, and there is a friendly, supportive environment for each and every single one of them to succeed together. But because of the small class size, you also get a small clinical rotation group as well. And because of that, you get a much, much better faculty to student ratio. Because podiatric medicine and surgery is going to be training you to become both a physician and surgeon, manual dexterity training is critical. And to that end, at Samuel Merritt University, in our human anatomy cadaver lab, usually each table is assigned to no more than 4 students. So therefore, you're getting a lot of hands-on time in terms of your dissection and the promotion of those skills so that you can be the amazing physician and surgeon that you aspire to be. What is also very unique to our program is that we start our students out into their clinical experience as early as the 2nd year. Most podiatric medical schools usually don't start students out into the clinical arena until the 3rd year. Unique to CSPM, or rather CPM, is that 40% of your 2nd year is going to be in some form of clinical experience enrichment, whether it is through our simulation lab, our clinical skills lab, in the motion analysis research center, with myself in your homeless clinic, or at St. Mary's, or at Highland Hospital, wherever the case may be. But 40% of your time is going to be exposed to that clinical training. And then in your 3rd year and your 4th year, you get opportunities to expand that clinical exposure and that clinical expertise so that you can hone your skill set. Unique to Samuel Merritt University College of Podiatric Medicine is our very own unique geography. We are located in the Bay Area. Over the past 4, 5, 6 years, if not the past decade, all of you have been hearing about diversity, inclusivity, right? The DEI engagement initiative, etc. For us, we don't just simply talk about it. We're located in the Bay Area. We're immersed in it. We live it. We breathe it. It is our every single day experience. Why is that critical? That is critical because you are engaging with patients that come to you for care from all aspects and from all ethnic cultures. So you're having that diversity of ethnicity, that diversity of culture, that diversity of language. So you have to learn and develop that bedside manner that is going shown to be superior to those who their entire patient population look exactly the same, who think exactly the same, right? And those qualities are something that you really can't be, that can't be bought. It's priceless. And so our students get an opportunity to be immersed in that environment every single day of their training. We are also affiliated with a number of clinical rotations that give our students top of the line faculty engagement as well as resources to provide that clinical care. So examples like Highland Hospital, which is one of the busiest hospitals, ER within the entire country that is located within Alameda. They also rotate through St. Mary's Hospital as well as San Francisco General Hospital. As I mentioned earlier, we've been around since 1914. The College of Podiatric Medicine were pioneers of biomechanics as well as sports medicine, and we remain nationally recognized for our excellence in educating our students within those arenas to date. In addition to that, our students get an opportunity to learn through our simulation learning center, as well as our motion analysis research center. This slide, I think, is very telling because this past March was our podiatric medical student residency match, right? And so fortunately and wonderfully for podiatric medicine, we have 100% match rate across all colleges, I believe. Is that right? Is that right, Jen? That, however, is not true for allopathic and osteopathic medicine. So if you were to visit that particular link that I provided there, you will see that this year alone, over 11,000 MD and DO graduates did not match. The year before that, around 12,000 students did not match. Compare that to the match rate for podiatric medicine and surgery. And so as a medical student, it is extremely scary for you to invest all of that money, all of that time, all of that energy, and then not to be able to get a residency, let alone a residency of your choice. For podiatric medicine, we are blessed that we've had 100% residency match rate, unique to SMU, CPM. Our students are able to usually get one of their top 3 choices. And that is very telling in terms of the quality of education that we can provide for you. I do want to dispel the myth that it is cost prohibitive to afford a medical education in the Bay Area. That is not true. If you are a cost-conscious student, you can live relatively comfortably with about $30,000 per year. Obviously, that is not inclusive of the cost of tuition. So just a couple of quick recap here in terms of some of the nuances that Samuel Merritt University College of Podiatric Medicine can offer you. Going on, here is a couple of slides showing you our students and our faculty in the clinical setting at Highland. What you should be aware of is that with our program, you're not only participating in the clinic, but you're also getting opportunities to participate in clinical research as well, because a lot of our faculty are very, very actively engaged in research. I mentioned a little bit about our Health Science Simulation Center. This is a multi-million-dollar resource that is available to our students to learn their clinical skills and hone that skill set. This Sim Center is actually one of only 3 that is nationally accredited west of the Mississippi River. And so we actually not only train our students here, but we actually have other educational institutions outside of Samuel Merritt University who come to us to use these resources. I mentioned a little bit about the Motion Analysis Research Center. Once again, this is a multi-million-dollar resource that is available at Samuel Merritt University. What is unique here is that this is a motion analysis research center and not simply just a gait lab. I think that that is a huge distinction that you need to be aware of, especially for those who are very, very interested in kinesiology, biomechanics, sports medicine, etc. So here you're not learning simply about gait, you're learning about the totality of motion. So this is incorporated within the curriculum at the university for biomechanics, sports medicine, but you also get an opportunity to participate in research within those arenas as well. Here are a couple of slides showing you the mark, but also the Special Olympics that is usually overseen by our very own Dr. Timothy Dutra, who is very, very well known and nationally recognized within the discipline of podiatric sports medicine. And here is, again, a couple of slides showing you the SimLab. Obviously, academics is important, but your connection to your community is important as well. So one of the mission statement of Samuel Merritt University is commitment to community and service. And so our students participate extensively in providing service to the community, whether it is at a medical screening, at a medical fair, or medical mission, whether it's local to our community here within the Bay Area, or medical missions to San Isidro, or even international events as well. That was quite abundant kind of pre-pandemic. Now that the pandemic has abated a little bit, I think that Samuel Merritt University will be looking to re-engage those international outreach opportunities as well. For us, mental health and emotional well-being was always a factor even prior to the pandemic. And so as a student body, students across all disciplines at Samuel University participated in our wellness days where we had service dogs, that come on campus for our students to play with. There's the ice cream social days, the burger days, the hot dog days, the softball tournament days. And so this is an opportunity for the students to connect, to engage, and to just simply play with each other, to kind of recharge their emotional and mental health batteries. And I think that the how important that is became very apparent when the pandemic came around. And so students became much more isolated. Everything had to pivot to virtual. And Samuel Merritt University stepped right along to make sure that our students were taken care of by providing telehealth service that was available to our students 24/7. But I think that those events that took place before the pandemic tells you how much at the forefront of student wellness the university is in terms of its approach and its care to its student body community. In terms of academics, I think these two slides will show you the kind of caliber that the university provides to our students. These are residency in-residency training exam for the first year residents across the entire United States. And so our students, this report kind of goes back to each of the colleges, and it gives them a comparison between their students and the rest of the podiatric medical residents across the country. And you can see that those in the blue bar, that represents students from our College of Podiatric Medicine, and then the gray bars are from students from all of the other programs. And our students usually outperform not only in the didactic categories, but also in the clinical arena as well. So it tells you that the curriculum format that we're following at the College of Podiatric Medicine is certainly providing dividends to our graduates. In terms of the podiatric practice, what does podiatry actually include or involve? Okay, so real life considerations. Why would you want to consider podiatric medicine versus, let's say, allopathic or osteopathic? One is that it is a guaranteed surgical specialization. You are both a physician and a surgeon. Your residency is more or less guaranteed to you. You definitely have a much better work schedule than your MD and your DO counterpart. Certainly, you are not going into medicine to become a billionaire, right? You have values and missions of providing care for your patients, but you will actually make a relatively good income to not only support yourself, but to support your significant other and your children, should you opt to have children. And podiatric physicians are usually under a lot less stress than their MD/ODO counterparts. And the last item here is what I usually focus and tell all of the prospective students that I talk to, is that your patients truly love and cannot wait to come in and see you for their appointment. I don't think that's necessarily true with our peers in the other disciplines, of whether it's internal medicine, dentistry, whatever, right? My patients, every time they come in, the first thing they tell me is that, oh my gosh, Dr. Tran, I've been waiting for this appointment for days, because they're so excited, because they know that when you are done with them, they are going to feel $1,000,000 better. So after everything is said and done, what are your opportunities? Where can you practice? You can become a major celebrity and star like Dr. Vincent. You can own your own private practice, or you can go into solo practice. You can go into a group practice, whether it's a single specialty group practice or a multi-specialty group practice, right? You can say, you know what, owning a practice is not for me. I prefer to go and work for somebody so that I can just get a paycheck, and then I can go home and not think about overhead and staff and human resources and all of the drama that goes with owning a practice. So you can work for a health maintenance organization such as Kaiser, or in some other states, there are other similar organizations. You can work for the VA. You can be part of a medical school. You can be a sports team consultant, or the attending physician in terms of for podiatry for those sports team. Or you can be like me and you can mold all of those things all into one, right? So I'm doing a medical school, I'm doing private practice. I mean, I'm just a jack of all trades when it comes to podiatric medicine, and I love every single minute of it. So what are some of the things that you actually get to do? For those of you who don't really know the depth of what podiatric medicine and surgery can offer you, you might think that all that a podiatrist does is just take care of nails and calluses, right? So I hope to dispel all of that for you by showing you what the scope of some of the things that we will do. So as a podiatric physician, you are a physician and surgeon that deals with all pathologies that involves the lower extremities. So if it touches the lower extremity, it is in your ballpark. So whether that is trauma, whether those are consequences of a metabolic condition such as diabetes, whether it is some weird and wonderful neurological condition that your patient presents to you, or whether it's actually a musculoskeletal deformity problem. It could be a vascular problem, it could be a skin or cutaneous problem. All of these things can make your feet extremely unhappy. I usually share with students and prospective students that your friendly podiatric physician is actually a multi-specialist that focuses on a specialized anatomical area. Okay, so think about that. Your podiatric physician is a multi-specialist that treats a localized anatomical area. So your podiatrist is an orthopedic surgeon, because we take patients to the operating room to fix their fractures. Those weekend warriors that have not exercised for a bazillion years suddenly decides that they need to get fit. They go out, they run 10 miles, and then they break one of their bones, right? So we fix those. We are your internist collaborators, those diabetics, patients who might not even know that they are diabetic. They come in because they have some weird, funny feeling sensations that's manifesting in their feet. So you get to be that internist that actually begin that diagnosis before you happily hand them back to their internist, right? We are the neurologists because we take care of nerve problems. We are dermatologists. When a patient has a derm problem, we take care of it. We don't actually have to refer that patient out to yet another physician. We are your radiologists as well, because your podiatric physician will take x-rays and read x-rays and read the MRIs and the CTs, etc. So here are a couple of slides that actually visually show you all of that. There's a surgical procedure right there to remove a very inflamed nerve. And then on the bottom right side of the slide there, you are exercising your expertise as a dermatologist treating verruca, viral infection of the skin. Here again is an ingrown toenail. So very, very painful for your patient. Growths that is occurring on that patient's particular toe, you will be taking that patient to the operating room and removing that for them. This patient is actually presented with that very, very dark streak. And again, you know, the thing that we're concerned about here is a potential malignant process. If this patient had no insurance, for example, or they didn't have very good insurance and they have to rely on a limited referral source, then waiting for a dermatological consult could be months in the making, right? Whereas if they come in to see you, you can actually address this for them within 1 to 2 visits. You can actually remove the nail, you can do the biopsy, send it off to pathology, share the results with the patient, give them a lot of reassurance that this is actually a benign process versus a malignant process. Deformities of the foot and ankle. This is where your orthopedic hat comes into play. You know, it would not surprise you that this is extremely painful for the patient. So you will take x-rays of this patient's foot. There you're exercising your skill set as a radiologist because you'll be reading your x-rays. Then you will be relying upon your knowledge of the patient's biomechanics and gait and motion, etc., so that you plan out a surgical plan that will not only be successful for your patient, but that will have minimal impact upon their ability to remain mobile, active, and ambulate normally. You are a limb salvager, right? A couple of years ago, I read a study that actually indicated that close to 40% of all limb salvage that occurs within the United States was actually performed by your friendly local podiatrist. That is huge when you consider that there is about less than 19,000 practicing podiatric physicians nationwide, and yet we provide close to 40% of all limb salvaging, right? Clearly, if a patient loses a toe or loses part of their foot or loses the entire foot or their distal leg, the quality of their life is going to be dramatically impacted in a negative way. And that can also increase the chances of them having additional injury and additional loss of digits and limbs on the other side as well. So the fact that you are helping to save their toe, save their foot, save their distal leg, you are having a major, major impact on the quality of life of your patient. Not only the quality, but also their mortality as well, because you are actually allowing them to live much longer. Here are a couple more exciting things that you can do as a podiatric physician and surgeon. This is a very extensive abscess that was a wound that took a couple of months to heal. Amazing ganglions, you know, that you are helping your patients here by removing them. Here was a patient who had a gangrenous toe, some pieces of glass that was embedded in a diabetic patient who had completely lost all sensation within their foot. And so they stepped on this piece of glass and it was embedded into their foot. I believe it was for close to a month or two before they actually went and sought medical care. For those of you who are really good at math, you will notice that this patient presents with a very, very unique situation right here. And so as a radiologist, you will take your x-ray, you will see that there's something very interesting there, and you will take this patient to the operating room and correct that for the patient. Other things that you do, this was in a pediatric patient right here who developed this growth on their toe over a 3 to 4 month period. We took a quick x-ray of his foot and you can see that huge bone growth that was on their big toe. Obviously that necessitated a surgical correction to go in and actually remove that bone growth. Other exciting things that happens in the emergency room that involves the foot and ankle. This is a dislocated ankle right here, extremely painful. The resident will usually go down to the emergency room, relocate that for the patient, and then the patient will be taken to the operating room later for more definitive correction. Other fractures and dislocations that you see here that your podiatrist will take care of. Again, dislocation of the big toe, a gunshot wound injury that appeared in the emergency room, and you would be called down to assist with that as well. Something much more complicated and much more exciting. This is an ankle fusion that you see on the top left, and then a flat foot reconstruction that you are seeing down on the far right. And another exciting thing right here, this is a gunshot wound that presented to the emergency room. The resident was called down and they actually shared this x-ray with me. And this patient was taken to the operating room to address that injury. This was actually a big toe that got completely shattered. The bone was completely shattered when a coffee table top, I believe, fell on this patient's foot. And so we took this patient to the operating room and we put those little mini plates in there to realign everything, put little Humpty Dumpty back together so that when the patient healed, their gait was not compromised. What is really interesting about this case, and I think this patient was extremely fortunate because they saw a podiatrist, right? Because any other surgeon would have gone in and would have said, you know, those little pieces of bones, they're too soft, they're not salvageable. I'm just going to take them out and I'm just going to let it go at that. Well, if that were to occur, that patient would end up with a very floppy big toe. And as a podiatric physician and your understanding of biomechanics, you know that a floppy big toe is a huge detriment to the person in terms of their gait and their ambulation. So we took the extra time to put Humpty Dumpty back together because we knew how vital that big toe is to his well-being. And so again, you impact the quality of your the life of your patients that they don't even know that you are impacting the quality of their life, but you know. And so that brings a sense of satisfaction when you know that you've done something really, really good for your patients, even though they're not even aware that you've been doing so. Right here, this patient presented to us as a referral from the emergency room. They stepped on a needle and the needle snapped in half. Half was embedded in their big toe. This patient was seen in the emergency room twice and they could not help her. So they finally referred her to podiatry. We took an x-ray and we took this patient to the operating room and we made a small incision and we removed that needle. And she was such a happy camper because it was no longer hurting. And then some other exciting things, right? This was a wonderful picture because this was actually in an 80-something-year-old lady who was residing in a senior care facility. And she was having major problems with walking because her feet were so painful. And they requested a podiatry consult. And when I went in to see her, I saw this. I lifted her bed sheets from her feet. And I saw this and it blew me away. And I said, oh my gosh, this is so amazing. And I said to her, I said, sweetheart, may I take a quick picture of your feet to share with my students? And she says, knock yourself out, take a picture. So I did, and I took extra care to remove that nail in one piece, just so you can appreciate how huge those things can be. But these are some of the more simple but very fascinating things that you take care of as a podiatric physician and surgeon. So I will share with you that this presentation is a whirlwind tour that I have compressed into about 40 minutes that normally would go for about an hour and a half, because there are stories that go with each of those slides that would just knock your socks off in terms of how interesting they are. But I do know that I have a limited amount of time here. And so I've tried to compress everything into a 40-minute, 45-minute. so that I can leave some time left for Ms. Bessette to share with you her wonderful stories. And then afterwards, we will be available for any questions. So Jen, I'm going to turn this over to you.
All right. Well, thank you very much for that, Dr. Tran. That was definitely, I mean, guys, I'll be honest, by background, I am not anything, a doctor of any shape or form. I have a master's in educational leadership, but gotta admit, sometimes those images, I'm like, I chose the right career path. Can't handle it. Can't handle it. Although next time you see toenails like that, I would like a coin for reference. So a penny, is it a nickel? Like what type of size were we talking about? So
Okay.
So for
Good point. Good
future
point.
people.
Thank you.
But I do thank everybody for being here today. My name is Jennifer Bessette, and I am with the American Association of Colleges of Podiatric Medicine, which is a mouthful. But what I do as the career promotion coordinator is I represent ultimately all 11 schools and help kind of educate prospective students, advisors, students in high school about the profession of podiatric medicine. So I am going to see, I have a short PowerPoint presentation that I will pull up for you. I believe this is going to be what I need. Do you see a single slide with the Colleges of Podiatric Medicine?
Yeah.
Okay, perfect. So while Dr. Tran did represent the Samuel Merritt University College of Podiatric Medicine, there are ultimately 10 other schools that you can apply to as well, and they are all over the country. So there are kind of 3 in the Western region. We have about 2 to 3 in that Midwest region, and then Southern and East Coast as well. So definitely options. Everybody has their strengths and their specialties. I will say cohesively, a lot of schools do have focuses in community service and giving back. So they're all going to have their unique ways that they do that. So for the process of applying, the most important thing that you need to know is that at a bare minimum, you need to have 90 credit hours, that's semester hours of coursework, of which most schools are going to look for that to be in your sciences, math, and then usually English, but I'll have another slide for that. We see, though, typically about 90 to 95% of our students have completed a bachelor's degree, and that is across the entire applicant pool. That's not specific towards any one institution. So students are typically earning that bachelor's degree before they are going on to podiatric medical school, although it is not required. You will need to take the MCAT, and the ranges will vary from school to school on averages. But overall, I believe across the entire applicant pool, we sit right around a 493 for a national applicant pool average. Strong GPAs, we're looking, again, nationally averaged out. We're looking at usually about a 3.3 for your overall and a 3.2 for your sciences. And then we are, of course, going to ask that you have shadowed a podiatric physician, surgeon, gotten to understand firsthand what that looks like. So we are having we're providing a couple on this slide, as well as an additional slide, resources to be able to shadow. So you can visit Step Into Podiatry to find a mentor in your area. A lot of times too, you can reach out to your school of interest, as they can usually set you up with a DPM to shadow as well. And then you are going to want letters of recommendation. And each school has kind of a different process for how they evaluate those. So as you're considering each institution, you'll want to just ask specifically what they are looking for. So as I mentioned, we do have our quick hitting kind of stats on what it looks like for coursework. You are going to be able or need to have those biologies, chemistries, physics, as Dr. Tran talked about. Biomechanics is a big part of that. So physics is one of the more important classes to have completed. And then they all do, of course, feed into preparation for the MCAT as well. There may be some additional classes that a school may require, such as biochemistry, or maybe they're specifically looking for a microbiology or an anatomy class. But these are kind of just the overall broad reaching. Every school is going to look for this at a bare minimum. Everybody else may have some additional requirements. So for the application process, we are coming up on just over, 100 days out from our end of cycle for this current year. So if you are still considering applying, there is still time. You're not late, don't worry. So you will need to get those applications in no later than June 30th of this year to be able to be considered to still start in the fall of 2023. Otherwise, if you're still waiting, not ready to apply yet, that is quite all right. We're still going to be here in the future, so you can definitely wait to apply. We will always open our cycle the first, I believe it's first Wednesday of August every year. So this upcoming year, it's going to be August 2nd. And then the date will always end on June 30th, no matter the year. Every school except for the Texas, they are located in Edinburgh, Texas, which is kind of in the Rio Grande Valley, Southern Texas region, think Corpus Christi. Their institution uses the Texas Medical School Application Service specifically. So they are the only one that you would not use the ACMAS website for. So what we do within our association is we kind of run and set all of that up. So we have kind of the database, as you can kind of think of it, of the resources for you to be able to apply to as you're considering your institutions. You can apply to one school, you can apply to all schools, you can pick and choose. It's definitely your preference there. So if you are looking for a mentor, additional information, you can either go to the Step Into Podiatry, or you can do discoverpodiatricmedicine.com to get some additional resources and information there as well. And then just a few last, just kind of quick resources, which we can definitely make available to you later as well. Just some great options. I can tell you that at AACPM, we are getting ready this summer to launch an additional resource for prospective students as well. It will be a web-based resource and have all kinds of fun information, links to videos. We can definitely connect with SMU, get some of those student testimonials that'll be on there too. So kind of just to make it easier to help support each individual school's resources and make it a one-stop shop for you as a prospective student. So overall, that's pretty much everything. You can find us on Facebook and on Instagram. We are always kind of posting our upcoming events, fun facts, sharing student testimonials and profiles, and then always kind of putting back out there what the fun things and interesting things that our institutions are doing as well. So I'll stop sharing my screen there. I do want to add one additional thing, because while I have a unique background, I did work for another podiatric medical school. I've worked for medical school admissions as well before coming into my role here with AACPM. So I do understand kind of what the questions that you're asking as a prospective student are as well. I will say one of the things that I think is really fun about podiatric medicine is going to be the fact that you can make the career as much as you want. So I heard from students that are like, well, research is really my passion. What can I do with that? Well, there's a ton of opportunity for research within the profession. There are DPMs across the country that go in and create patents on surgical devices or techniques. They're kind of evolving the profession through research and innovation as well. So if you are somebody who thinks along those lines too, podiatry can definitely be a great fit for you as well. So it is a nice profession that you can truly kind of cater and meet your needs and the career you want to have long term. So but I think it's enough of kind of the boring stuff, but I'm happy to open it up to questions at this point.
Okay, we have a question. What is the average amount of letters of recommendations that podiatry schools require or allow?
Ultimately, you can submit, I believe it's up to 5 through the application service itself. You can always, if you have a specific one, work with an individual institution to send a letter specifically to them. I would say though, on average, it's usually about 3 letters of recommendation. 1 letter from a DPM that you've shadowed, spent time with, gotten to know. Another letter from usually a strong academic reference. And by academic reference, I don't mean just somebody's science class that you took once. This would be somebody that was maybe a research leader for you that you worked with closely. You took multiple classes. If you were a TA in a science subject, maybe having that faculty member write that letter for you. And then usually 1 additional professional reference letter. And that can be from a healthcare provider, or if you work as you're going through school and have your supervisor or boss that wants to write a letter of recommendation for you, you can do that. Or if you're a student athlete, you can have a coach, so on and so forth.
Yeah, I agree. When I was applying, I had different types of letters of recommendations, not just from my my professors, but also I did a little bit of research. So I got a letter of rec from my PI. But also I would say in terms of letters of rec, like you definitely really want to make sure that you know them. And it's not just a professor that you just attended class and that was it. Even if you got, a good grade, I think it's good to make sure that they know you as a person and that they know that what you strive for. So kind of that's what I would also add to that. Okay, we have a couple questions about the MCAT. Someone was asking that you mentioned that the average is like 493, but they wanted to know if the MCAT is, first of all, like mandatory, and then the second thing is what if you know the minimum and the maximum MCAT scores.
So overall, each institution is going to have, the maximum, I believe it's a 4 or it's a 528. I don't think you can score any higher than that on the MCAT. So that would be our maximum. The minimum does vary from institution to institution, I would say. And when I would advise students, targeting for about a 500 is usually the threshold you want to be at. Every institution is going to look at things very differently. So they may look at individual sections of your MCAT and consider one section over another a little bit more strongly. I'm sure Dr. Tran can speak to how they do that at SMU. So the minimum, I can't really speak to. Every institution is going to be a little bit different. The number, when I gave out 493, that is the national average given the last application cycle. So of all of the applicants that applied, that's what the average ended up being. So realizing that I'll probably do some additional research, figure out what the median is, because the median is probably a little bit more of an accurate representation of the overall class. But yeah, the average is a 493 nationally, but it is required. There are a few schools that will also consider the DAT, which is the dental admissions test. So you can kind of pick and choose which one you want to do, but just be very, very careful, because every school is going to require the MCAT and not every school is going to even consider the DAT. So do your research before you open the DAT can. So
Yeah, I would say that out of the 11 schools, I think there's only 2 that will consider the DAT. So the other 9, only accept the MCAT. So as Ms. Bissett mentioned, before you start preparing for the DAT and put out the fees, et cetera, to sit for that test, just know that that will only be helpful for 2 of those out of the 11. In terms of the MCAT, as Ms. Bissett mentioned, every school is going to treat each applicant differently. For Samuel Merritt University, we do adopt a holistic approach. So if your MCAT score is not around a 493, a 492, or around that ballpark, we will, based upon the applicant, right? So for example, if their other metrics are very, very strong, and their personal statement is very, very strong, and they have amazing extracurricular activities, that would explain why their MCAT score is not quite as robust as it should be. But we are convinced that they would make an amazing candidate, an amazing podiatric physician, if they were given the opportunity to realize their dreams. And yes, then we will definitely extend an invitation to that candidate to interview. But your safest course to navigate would be to at least get that national average.
Great. And you kind of talked about GPA, but someone was asking, how do DPM schools calculate science GPAs? Is it similar to the AMCAS or the AACOMAS that calculate the biomedical BCPM? Do you know what that is? BCPM?
Yeah, I do. We will use a true BCP. Usually math is not factored into that science calculation. And most schools will look at your total overall science. So anything that is classified, and if you go to aacmas.org, they will have it'll break it down for you on their website as to what exactly is a science GPA. So it's anything that's typically a life science, biology, chemistry, physics, organic chemistry, biochemistry. Those all get factored into that, and it's through any level. So a total overall would include undergraduate, post-bac, and even graduate level courses if you go that far before you apply to medical school. So it would include all of them. The nice thing too is that every school will have the ability to kind of look at your science trend. So in addition to highlighting that GPA for the schools, we will also give schools the opportunity to see how you did in your first year, freshman year, sophomore, all the way through, like I said, through graduate education. And so they can see, everybody has hiccups in their academics. It's very rare that we see somebody who has had perfect with no flaws come into podiatric medical school. So just know that we will look at your overall trend. And if we see that maybe you struggled, you had a life event that impacted classes that you took, but you recovered and demonstrated a strong GPA from there, then it's going to be looked at favorably. If you retake a class, that is factored in as well. So it's not going to be that your first attempt is omitted. All attempts will be utilized in that. Many schools, like I said, will look at that trend and see that, yes, you did do better. So even though your overall total science may be lower, you did better in that class, and we can see the trajectory of your GPA get stronger individually. So.
Dr. Tran, a couple of people are asking questions about admission process and what's the secret and how to be competitive. I kind of like to call it, what's the secret sauce of getting into SMU?
So the secret sauce is just to be who you are. So as I mentioned, we do take a look at each applicant from a holistic standpoint, but clearly you have to meet basic metrics, because we do want to make sure that you have the academic capability to be successful within a medical school. So I would say that from an MCAT standpoint, you should be hovering around a 492, 493. Your GPA should be hovering around a 3.2 to a 3.5 for cum and science. Now, if you say, well, you know what, I don't fit into that picture because I have a 499, but I have a 3.1. So what does that make me? Am I not eligible because one of my numbers is low? And the answer is no. Right? We look at your whole package. We look at you as a whole person. And then if you are fortunate to be extended an offer of an interview, just be who you are. Podiatric medicine is different than allopathic and osteopathic medicine, that our intent is not to stress you out and pimp you on the spot and ask you to recite the Krebs cycle, that kind of thing. We want to know that this is the profession that you have chosen and that you will make a good podiatric physician, so that you carry on the good name and the good reputation of podiatry as a profession, right? That you are not going to be that one person that's unhappy out of the 10 podiatrists that is practicing out there. So that would be the secret sauce.
And then the other question is, people are asking what's the percentage of getting in and average and data. And I'm sure there's a lot of data on that, but I will share this one data, and I'm sure Dr. Tran would be okay with this, is that 100% of people that don't apply don't get in. So if you don't apply, you're not going to get in. So that's,
yeah.
But a lot of people are trying to game that system. And so can you share a little bit about those datas and
So I would definitely agree with Jubin that if you don't apply, there's 100% guarantee you will not get in. But I think that Ms. Bassett will probably have more information in terms of numbers than I do, because she works from the association. What I will tell you is that the level of competition that you have for podiatry for gaining admission is going to be astronomically smaller than if you were to pursue MD or DO, right? So, just 2 or 3 years ago, there were over 54,000 students applying for MD seats alone. So if you were to take a look at the number of candidates per seat, on average, you're talking maybe about 5 to 1. That's on average. Now, for certain medical schools where everybody wants to apply to, you're potentially looking at a ratio of 50 to 1. So what that means is that for every single seat that they have, for every 50 applications that they have for one seat, 49 has to be denied. Right? If you take a look at the average number, let's say that's 5 to 1, then for every seat, 4 has to be denied. With podiatry, because no prospective students know about what an amazing field, an amazing discipline this is, you are having maybe a ratio of 2 to 1, or at best a 3 to 1. So your potential for being looked at, and then when you combine that to the holistic approach that most podiatric medical schools adopt, your chances of being admitted into the program is pretty robust. Jen, can you add anything else to that?
No, I think that's actually probably a pretty good evaluation of everything, because I don't have the specific statistics of how many students apply and don't get in. Because it's also not a matter of like if students apply and don't get in, it's a matter of if students apply and maybe this is their secondary choice, and they get into, another program that was their primary choice. So there are other factors that lead to why students may not accept an offer from an institution. But I would say that the understanding that, like, on average, a student is applying to, I think, about 3.5 schools for their application cycle. The more schools that you apply to, the better chances you have of being considered and offered an acceptance. The fewer schools that you apply to, you're just kind of playing that numbers game a little bit, but I would say that your evaluation is pretty accurate.
Great. So we have one other question. So regarding letters of rec, if a letter is written, do you have to have a letter of rec from a podiatric surgeon?
So for Samuel Merritt University College of Podiatric Medicine, we recommend 3 letters, 2 from faculty and 1 has to be from a DPM.
So everyone that's here, what they mean by recommend is you should probably do it. Highly, highly, highly do it.
Yes.
So so I think a lot of people always get involved in this thing about, oh, well, something is recommended. No, it's probably required because everybody else is going to be doing it. So just being competitive. So if you hear recommend, just in your mind, make the quick change to required.
Yeah, and I would say that most institutions of podiatric medicine, they are going to expect that you have a letter of recommendation from a podiatrist, from a DPM specifically. And if you don't have one at the time that you submit your application, many of the institutions will anticipate that that letter will be received either at the time or around the time of consideration for admittance. So.
And I think I would just add to that. I think why that requirement is that kind of look at it if you want to join a society or group or anything, in my culture is that, if you want to go to a party or somewhere special, you have to take somebody that knows you, that is from that group and kind of introduces you. And so look at that letter from a DPM of somebody who is in that career and field that knows you, has gotten to know you more than like 2 hours, hopefully, but has gotten to build a relationship with you and is telling those schools, hey, you know what? This dude that's applying, he could get into our club, or, I mean, if you're rushing a fraternity, you have to have a sponsor. If you're trying to join an organization, you have to have a sponsor. And so it's this kind of the same concept of why, podiatry schools want a letter from a DPM is kind of like, secret handshake or whatever.
Yeah, I would also add that, some of you might be learning about podiatry today and may want to, if you already have everything ready to go, want to apply this cycle. In that case, I would say you can try to apply without a letter of rec from a podiatric physician if you're kind of in a rush. Obviously, like as we've been saying, it's probably better to have a letter of rec, but again, it's like very much recommended, but not exactly like 100% required, but it would definitely be helpful. But I would say if you're like in a rush and you don't, I wouldn't say don't let that hold you back from applying if you don't have that. But if you do, that's great. Someone says, if we attended a 3-day internship at SMU, will that give us the opportunity to interact with a podiatric surgeon and get a letter of rec? I'm not exactly sure if we have internships, but I would say if you have the opportunity to connect with Dr. Tran, and I'm sure he could recommend you to a podiatrist in the area, and if you could shadow that podiatrist and get to know them, then I think that is possible.
So I think that what they're referring to is the summer immersion program that the College of Podiatric Medicine offers during the summer. So that's a 2.5, 3-day program that is an intensive exposure to what podiatric medicine and surgery is all about at Samuel Merritt University. So if you apply to CPM after attending that program, then yes, we will consider your experience with us as qualifying as that letter of recommendation. However, that doesn't apply to the other colleges of podiatric medicine. They will probably not consider that as a qualifier, right? But for us, yes, we will consider that as fulfilling that letter of recommendation from a podiatrist, because you will be spending your 3 days with more than one podiatrist. You'll be spending with several. Yeah, so.
And there are immersion programs that are offered at many of the institutions as well. The timeframes will vary, but that is an opportunity that if you're looking to consider, because I do know there are podiatry students who will attend their first choice school immersion program, and then they may attend a couple more just to get a better understanding for how that institution works. Many of our schools have brought back those programs now that we have kind of taken some time. We've gotten over the COVID hurdle, and institutions have started to open their doors back up to having longer visitors on campus. Yes, that is a possibility that you could attend the program that's offered at SMU or any of the other schools as well. And usually too, because like I know if you're not able to attend, sometimes it is a lot to attend the 3-day the program. Maybe your schedule doesn't allow for that. As I mentioned earlier, if you reach out to any of the institutions and you ask for resources to help shadow and get a mentor, usually they are going to be able to provide you with somebody who's in your area to be able to do that. Again, you can always go to the Mentors Network, but you can also reach out to institutions and be able to get direct references from them, since they usually are referring you to somebody who is somehow intertwined with the program itself.
I agree. Someone says in the chat, for an applicant that has an upward science trend, and has done graduated from UCSD, did a post-bac for 2 years, and has been raising their science GPA, and hopefully has like a 3.0 science GPA by the end of the year. Should they consider applying for another post-bac if they're around at like a 3.0?
So what I will say is that for us, we take a look at least your last 60 units in order to determine your trend. So if you have plenty and you have at least that 60 units from when you graduated, and by the time that you have reached your current GPA or getting close to that 3.0, then what I would suggest is that just consider submitting your application, because that last 60 trend will probably convince the admission committee to give you the benefit of the doubt and give you the opportunity to move forward, and you have potentially saved yourself an entire year, because most podiatric programs only admit once per year. So you've saved yourself a whole year. So I would consider go ahead and apply. The nice thing about podiatric medicine is that if you don't get it in 1 year, it is not held against you, right? So it is not held against you for you to reapply the following year.
I will add, if you know that you're taking summer classes and you need those science courses that you're taking over the summer to be factored into your GPA before you are considered, wait until those final grades are published on your transcript before actually submitting your full application. So whatever that term is, if you need to wait until the end of the fall semester or quarter to be able to get those grades in before you submit, do that, because you can submit academic updates, but they typically are not then reflected in the hard GPA calculations. They will update your academic history and let us know how, and we will then, or Samuel Merritt will know how you did. forgot that I don't actually have anything to do with that anymore. That they will know how you did. And that is important. But if you really need that number, that GPA number to be stronger, wait until those final grades are published.
We kind of answered one of these questions, which was if you apply and are not selected, is that seen as a negative applying the next session? And that was no, right?
Yeah, it's not. Most schools are going to want to know what you did. Did you take more classes? Did you do more shadowing? Did you work professionally? But really, they just want to know how you took the time to improve. Is going to be the most important thing when you reapply.
Yeah, and I think in general, there's a thing says, if you do the same thing over and over again and get the same results. So if you're going to reapply, make sure that you have, improved. You have something different, not the same thing. So
Yeah, definitely agree. Did you want to add anything to that, Dr. Tran?
No, I think that's a very fair comment and suggestion. If you are going to be reapplying, show that you've taken some action, show that you've made improvements, show that and those improvements are substantial. For example, if you apply 1 year and you didn't get in and your GPA is very poor, taking 2 classes is not going to cut it by the time you reapply. Take either a whole year, go back, do a post-bac, or if you don't want to go and do a formal post-bac because it's too cost prohibitive, you can take science courses at a community college, but take it in a robust semester. Don't take 1 class, right? Take at least 12 units, 14 units, 16 units to show that you can handle that volume of workload, and that despite the volume of workload, you did great and you got A's in all 14 units. Because when you get into medical school, it's not 14 units, it's not 16 units. You're going to be handling around 20-something units per semester, right? So if you say, I didn't do so well in that year when I applied, I went and I took 2 additional classes, and look, I got A's in all of them. That won't cut it.
what if you have to work or take care, what do you have to work to support yourself? Is that okay, or is that?
So that I don't want to say that is okay, but when you clearly indicate that within your personal statement, then that will be factored in. So for example, when I look at an application, or when Mr. Hewlett takes a look at an application, and when our interviewing faculty takes a look at an application, and you are only able to take 2 or 3 classes per semester because you have to work 40 hours per week just to support yourself or to support your family, then we can understand why you are not able to take 14 semester units, right? And so if you take 2 classes, which is 6 units or 8 units, and you got A's in all of them and still were working 40 hours a week and volunteering, and doing clearly you are going above and beyond, and you are an amazing individual. We'll say absolutely. But if you're taking 2 classes and you're doing absolutely nothing but watching anime every single day, aside from taking those 2 classes, that will not work.
Mm-hmm. Definitely. I think there's a lot that you can do in that year to improve your application and make yourself a stronger applicant. And someone says, is it too late to apply now for the upcoming class?
It is not.
It is definitely not. Yeah. The application is open until June 30th. So there is still plenty of time to be able to apply. The catch would be is that you do need to have the MCAT completed. So you will want to reach out to institutions. I don't know what the next test date is for the MCAT right now off the top of my head, but you'll just want to make sure that it aligns within the application window to still be able to apply. And I will add one thing too, like this comes, whether you're reapplying or taking a gap year, because gap years are more than acceptable as well. reach out to the institutions. I don't doubt that the admissions staff at SMU CPM are going to be more than happy to talk to you about ways that you can individually strengthen an application. I know when I was on that side, I was always more than happy to talk to prospective students and kind of let them know what the best pathway for them individually is going to be, because so much of it is an individual situation. We can talk broadly about lots of things, but so often it's unique to you, and we want to be able to help you be as successful of an applicant as possible. And I promise, if somebody's telling you to wait to apply, they're not doing it to derail your goal. They just want you to apply once and have the strongest application that you possibly can, and have success that first time around. So just keep that in mind.
Definitely. And I wanted to ask, some of these students are in community college, or could be in community college, and how does that factor into your application to like a podiatric medical school, as those community college credits?
So for CPM, you can apply 60 semester units from community college level to the application. Right. So most applicants need at least 90 semester units of undergraduate work, as Ms. Bissett mentioned probably during earlier. I would say for CPM, 95% plus of our students who come in have a bachelor's degree, so that is not an issue. But if for whatever reason a candidate has to take the majority of their courses at a community college, they can only use up to 60 semester units to apply to their application.
And like the prerequisites that are required for podiatric medical schools can be taken at the community colleges?
As long as the community colleges are fully accredited, yes.
Yeah, I personally went through community college, so I thought the other classes were great, and my prereqs definitely were fine to apply, so it worked out. And the same thing for post-bac, like the prereqs that you could take through like a post-bac would be accepted, right?
Yes.
Great. What about in terms of if someone wants to transfer podiatric medical schools? Is that possible? Is that an option that's out there?
Okay. So for CPM, a bazillion years ago, that was potentially an option. We have discovered that the colleges of podiatric medicine, the curriculum was different enough that allowing a student to transfer places a undue hardship on them to be able to catch up. So for us at CPM, the earliest that we had contemplated a transfer was the first semester of the second year. But even that was causing a lot of stress, because there were at least 2 or 3 preclinical classes that for us, the student would not have had completed, such as the lower extremity anatomy or something else. And so they would have to complete that while they were going through all of the other courses within the second year as well. And so that was a lot of challenges and stress that they had to go through. So during my tenure at CPM, we have not had a transfer, or we have not had permitted a transfer probably for the past 5, if not 7 years.
Mm-hmm.
I will say it's not impossible to transfer. One of the things that's important to keep in mind when you're considering podiatric medical school, or really any professional school ultimately, is that unlike in undergraduate, where it was very easy to go from a community college to a university or transfer from university to university, that is not going to be the case at a professional school level. Sometimes the curriculums, like Dr. Tran mentioned, won't align perfectly, and it could put a student at a disadvantage to keep up. The other side of that becomes when when a podiatric medical school takes in a class, they know that's how many students that they need to put into rotations. And they need, sometimes the only way they can take on a transfer is if they had a student take a leave of absence or no longer be a part of that class, because then they could put that transfer into that seat, because they only have so many rotation sites and scheduling that they can do. So it's not necessarily that we don't want to support transfers. Sometimes there are things on the back end that make it very, very difficult for a school to allow transfers. When I was on the admission side, and I did it specifically for podiatric medicine for about 6 years, I only saw 2 transfers, and there just happened to be space in the class that they were transferring into, and the curriculums just happened to be comparable enough that they weren't going to have been behind. There are other factors that come in too when it comes to when you take your board exams and how you prepare for those board exams too. So it's very unlikely that if you're past a second year that any school would consider a transfer at that point in time, because when you get into the rotations, it becomes much more difficult.
Right, right. That makes sense. What are some mistakes that some students make in their application, or like what should people avoid?
I mean, I've seen lots of silly things, like people misspell their names because they rush, or they're nervous and they're not thinking about it. Especially when standardized tests are involved, make sure your application, the name on your application matches the name on your MCAT. That's usually a big one. More in particular for female applicants, if they get married in between taking and applying, there could be things like that, but there are ways to indicate if something like that comes up. I would say the other big thing is not including enough information. So I'll talk from like an advisor perspective, and then I'll let Dr. Tran jump in. But like, there was always times where I could look at an application and I could see great academics, and then maybe nothing in their like extracurriculars or supporting information. Like, what were they doing? Were they working? Were they not working? And while it doesn't necessarily impact as negatively if you've done well in school, if you did have hurdles academically, or maybe you were less consistent with your grades, but you don't tell us that you were working at Starbucks and you were working the first shift and opening at 5 a.m. and then going to class immediately after your shift ended, then we don't know that because you were working at another job. So it's important to list your non-healthcare related activities as much as it is important to list your healthcare related activities. And again, if you're ever not sure, just reach out and ask, because that was when in doubt, just ask. If you're not sure, just ask. So
the other things that I would add on is just be conscious of what general etiquette involves, right? So, you know, Ms. Bissett has talked more about the structure of your application, what to look at in order to avoid pitfalls and those details. But in terms of your overall approach to your application process and your medical schooling as a whole, I think that's important too. So for example, if you're reaching out to a medical school admission person and ask a question, just be mindful of how you are addressing them, right? You are going into a medical profession. You are going to become a professional. No matter what you were taught at high school and undergraduate institutions, you have to address people by the appropriate, in the appropriate format. These people are not your best buddies. They don't even know who you are. if you're trying to reach out to Ms. Bassett for guidance, for example, if she was an admission advisor or counselor, you don't send out an email and say, "Hey, Jen, how's things going?" Right? Or you don't email me and say, "Hey, David, can I ask you a question?" Because while that may, you've been taught at the undergraduate level that was a way to engage someone in an informal way, a friendly way, a less stoic way. Yes, that's helpful in a social setting, but even then that's kind of iffy because you are talking about professional education, professional a pathway here. So address people in the appropriate way. Dear Ms. Bassett, I have a question about this. Can you provide me with some guidance? Take a look at the credentials of the individual. Dear Dr. Smith, dear Dr. Jones, I have a couple of questions, right? If they have an MD, a DPM, a PhD, something, give them due respect for the hard work that they have provided. And also, if you apply and you set up an interview, it blows my mind that a candidate will not show up for their interview without alerting the medical school. This does not only happen in a podiatric, but I'm also sure this happens in other disciplines as well. Well, here's the kicker. Podiatric medicine as a profession is not that large. We will remember who did not show up. And let's say that person graduated from institution B, goes into a rotation, somewhere someone who has the memory of an elephant will remember, wait a minute, this person applied to so-and-so and didn't do XYZ. And so you can potentially be burning your bridges further down the road than you recognize. So be professional, follow social etiquette when it comes to just to life in general. And then that way you can ensure yourself a relatively pain-free and smooth transition from entering medical school out into clinical practice.
Yeah, and also it's really important if you're contacting someone, there's this really cool new invention called Google that you can Google them and find out a lot of information about them and just addressing them properly. Like this is not, this is not that, and I'm just going to use Dr. Tran as and Ms. Bassett as an example. It's not that they have big egos that they like to be called. I'm sure that they have their professional life, but it's not so much about them, but it shows about you and how professional you are towards them. Because if you don't know someone and you're not professional to them, how you're going to be if you know them or you're in a stressful situation or any of those things, it's a bigger reflection on you as a person than it is on them wanting to have their, it's not for their egos. And so and I think and I think that yes, it's okay to be casual, but it's also something that's earned. I'm sure if you work with Dr. Tran long enough that you will be on first name basis, or he will say, "Hey, just call me, David or whatever." But it's a thing that it's kind of lost, and I think it's really difficult because we've been remote so long that and so there's nothing wrong with being casual, but I think it's really important being professional because, and you are representing yourself, your family, your name. And so, and also the other one is don't be short with staff. Like if there's something that's gone wrong, this is not life and death. It could be fixed, if there's something wrong with the application or something has happened or someone made an error. Worst thing you could do is call them up and tell them four little words, because that just basically shows that you can't handle stress and adversity. And yeah, and people make errors, but it's not life and death.
That is a very good point. I won't go into detail, but I do know of a professional school that revoked an acceptance from somebody who mistreated an administrative assistant they were able to do that because it fell into the student code of conduct that they, as an accepted student, were expected to follow. And so they, again, not podiatry related, a different profession, but did dismiss their acceptance as a result of it, because, you know, how are they going to treat staff if that's how they treat somebody that's helping them through the process? So do be polite. Don't no call, no show on your interviews.
And I could just tell you, someone who works in the health professions field, what you see on TV does not happen. Doctors cannot walk in the OR and throw instruments around because they will be escorted out. And I don't care who you are, that just does not happen. And I don't own a TV, but I watch some TV shows that stuff happens, and I'm like, I tell you right now, if a physician does that in our ER, they will be escorted out. And and it just doesn't happen. Um and so I think that's a more professional sense. But if you're doing that as an applicant, trust me that not a lot of people would want to be around you, because you're a liability ultimately.
I agree. Yeah, I think be courteous with everybody in general, whether during applications or not. But I would also say, if you can, try to respond to emails within 24 hours. That's also something that can be helpful. And yeah, like everyone else was saying, try to um, acknowledge people in the right way and say like doctor, whatever their name is. And then if, I mean, generally, like in the medical profession, that is what you want to do, especially like as an applicant, especially as a student, especially as a resident. And then if you become close friends with them, eventually they'll like, that's fine. But especially as an applicant, be careful of that. I would say also, to add on to kind of ways to help with your application, I would say have someone look over your personal statement. Having a different set of eyes to look at your statement can definitely be helpful. Not too many people, but at least a few different eyes. I think I went through like 4 or 5 different drafts of my own personal statement, and I had someone that was really good at reading and giving feedback that would look over it. And there was definitely tons of mistakes in my first draft, so I'm glad I didn't just send that. There was like, grammar and all of that. You want it to be good, so definitely have someone look over it. And then yeah, I think that's all I would add to that process. And then another question is like, how do you find support for your application? I think, yeah. Do you just mean in terms of like support in terms of how you can find mentors, or
Yeah, like support and resources.
support and resources? How do you find support and resources for your application?
I mean, honestly, I think turning to the individual admissions departments at the school that you're applying to is always a great idea. Dr. Tran does the information sessions. A lot of them are still being done virtually, and information sessions have gone to a virtual format because it is easier. You can go and attend information sessions at multiple schools without having to leave the comfort of your living room, which is a great benefit to the results of the pandemic. So take advantage of those. Visit as many schools as you can. Having that knowledge about the institutions as you're getting ready to apply is important. As we mentioned earlier, it's not easy to transfer, so knowing where you want to go and being confident in that is important. With that being said, there's also going to be opportunities for shadowing. You can contact the institutions directly for that. Step Into Podiatry has a mentors network as well. You can utilize that. We do a lot of work within our association with outreach to pre-health advisors, clubs, and organizations to provide workshops for you to be able to do within your within kind of your classroom setting. We do a suture workshop, we do a sports taping workshop. We will send you the supplies. We will set you up with a DPM. And a lot of times those DPMs are often heads of residency programs. So they will bring residents along with them. So you're getting the professional perspective plus the student perspective. We are, I would say, across the board, a profession that is very supportive of getting you in touch with people to help be successful and learn about the profession. And most DPMs are very open to having you come and shadow, especially as we've come out of the pandemic. So just reach out and ask. Schools, us as an association, we will always do our best to get you in touch with somebody who's in your area to be able to provide you with shadowing opportunities. And then the schools are a tremendous resource. I know as much as I can do from the association, I can only talk generally about requirements and expectations from an applicant, whereas the individual schools will be able to give you a much more like, while I'm giving the 30,000 foot view, they're going to give you the 5,000 foot view of what they want to see specifically. So just reach out and ask. They're there to help you.
The only other thing that I would add is if you're in California, you could go to any community college to their career center and transfer center, and you could use it even if you've never been a student there, or if you've never been a community college student or ever attended there. They will help you just looking over your essay and edit it. And they usually have like English faculty that do those editings of those essays. So they're going to be much better than a podiatrist who is not probably good at editing. Some of them have done copy editing. So, and that's like free. You don't have to pay for it. You don't have to be a student or anything. You just go in there and say, hey, I'm from the community and I need, and they will help you with that. And it's free.
It's a great resource.
Great. And I would say we're kind of coming to the end of our session. Any last words you want to say to anyone considering podiatry?
Other than the fact that podiatric medicine and surgery is a great specialty and it's a great discipline. And I think that if you go into it for the right reasons, you will not be disappointed and that it is extremely fulfilling. And, you know, what I would say is don't listen to the noise, look for the content. Because if I deliberately not look on some of the forums that students may access, such as the Student Doctor Network, for example. You just have to remember that all the negativity that you might hear or see, you have to take everything with a grain of salt, right? As a profession, the people who are not commenting on the negative comments that is existing on these forums, it's because they're too happy doing what they're doing to waste the time to kind of offset the negative comments of these people. And these people who are making all of these negative comments, they're unhappy about something and they're taking it out on the profession itself. And that's not necessarily appropriate or correct. So for example, I'm sure that there are some unhappy MDs and unhappy DOs out there, but do they go and trash MD and DO as a profession? No, right? If you actually go and shadow and you talk to 10 podiatrists, the 8 that are happy, they don't have time to go and talk about negative things about the profession because they're too happy doing what they're doing. So, try to ignore the noise. Do your research, do your own personal exploration of this profession. Go and shadow, go and talk to the podiatrists close to you, and then make the decision on your own. Don't be swayed by the noise out there because a lot of that noise is just simply incorrect.
Yeah, and the people that go on a lot of boards, I've gone a couple of times on Reddit and other stuff, or even social media. I just call them keyboard warriors because they've got like the answer and expertise to everything, but they probably are not doing it. So um, people talk a lot of smack, and I think ultimately, like, somebody who could post on those boards, you don't know their name, you don't know their title, you don't know their experiences, but they have this wealth of knowledge to share with you, but then you don't know who they are. So I just said, what is it called? Take it with a salt? No, wait, grain of salt. Yes.
Yeah.
Yeah. Yeah. Um, yeah, I echo Dr. Tran's sentiments and thoughts. I will also say it's a really great profession. I come from a background of advising for other health professions. I've advised and done application work with medical students on both MD and DO, and at prestigious institutions. I will say podiatry, I still come back to it because it is something that they are happy. Don't let people be like, well, you're only going to do foot and ankle. Only foot and ankle. Like, your feet are some of your most important body parts. So don't let somebody say that that's like a less of a profession. If you've ever broken your foot, which I have, and had to be put in a walking boot, like, you kind of you devalue your feet, and you don't really think about how important they are to you. So just remember that you're going to do everything within the foot and ankle. If you're going to go to medical school and you're going to become, I don't know, you get stuck with urology, then that's it for the rest of your career, urology, unless you go to podiatric medical school, and then you can do surgery, and you can do bunion surgeries one day, and you can do flat foot surgeries another day. You can do ulcers and ingrown toenails and a whole bunch of other things that, because I'm not a DPM, I can't really speak to, but they look cool in pictures. But they are truly some of the happiest people that I have ever met, and I will stand by that wholeheartedly. So it is a great profession, and nobody makes it easier to find a place to shadow than podiatrists. So reach out, ask us for resources, and we will be happy to provide them for you.
As Jubin and Ms. Bessette was talking, it reminded me to make one final comment. Then this will be my last comment. In the state of California, as a fully licensed podiatric physician, you are allowed by law to assist as a secondary surgeon on surgeries involving any other parts of the body. So think about that. That is not true in any of the other 49 states. This is only true in the state of California, right? Now, I will also tell you that every single podiatrist that I know, even though we have been granted by law the ability to assist our fellow orthopedic surgeons on any other part of the body, every single podiatrist that I know have never done it. And the reason is not because they don't have the skill set, but because they don't have the time. Their time is eaten up by all of the patients of foot and ankle problems that they barely have time to take care of those patients and do those surgeries, let alone help out their knee specialist or their hip specialist or their shoulder specialist or whoever other specialists. So to wrongly suggest that podiatric medicine is not worthwhile, is somehow inferior to any other aspect of medicine is just woefully wrong and inaccurate. As Jen mentioned, your variety within podiatry when you're in your clinic keeps changing from patient to patient. One person has a wound, one person has an ingrown, one person has a wart, one person has a bunion, another one has a hammer toe, the next one has heel pain. It keeps changing, and so it's fun. Whereas, as Jen mentioned, if you're in urology, you're just stuck with urology, and that's it. And so your variety is really not that it's not that diverse. Okay. So anyway, bottom line is it's great. It's a wonderful profession. So there you go. Last comment.
Great. Thank you so much for joining us today, Dr. Tran and Ms. Bassett. We really appreciate all your comments that you helped us with. Yeah, they said appreciate the comments. And I hope that you have a great rest of the day. I think we'll take a 10-minute break before the next session.
Thank
Thank you,
again.
everybody.
Thank you for making it.
Enjoy the rest of your session.
Thank you.